Hello, and welcome to the Feeling Good podcast, where you can learn powerful techniques to change the way you feel. I am your host, Dr. Rhonda Borowski, and joining me here in the Murrieta studio is Dr. David Burns. Dr. Burns is a pioneer in the development of cognitive behavioral therapy and the creator of the new team therapy. He is the author of Feeling Good, which has sold over 5 million copies in the United States and has been translated into over 30 languages. His latest book, Feeling Great, contains powerful new techniques that make rapid recovery possible for many people struggling with depression and anxiety. Dr. Burns is currently an emeritus adjunct professor of clinical psychiatry at Stanford University School of Medicine.
Hello, Rhonda. Hello, Brandon. I still don't know if I'm able to give strange hellos, because in our feedback survey, some people said they hated it, so I've kind of stopped doing it, but we'll have to wait and see.
I kind of love it, but I imagine there's a mix of feelings about it.
Hopefully the lovers will bring it back.
Right.
Well, hello, everyone who's listening around the country, the world, throughout the galaxy. You are turned into the Feeling Good podcast, and we are at episode 472. That third voice you hear is Brandon Vance, who is our very special guest on the podcast today. And I'd love to introduce him to everyone. He has been on the podcast before, both recently on our musical podcast and at various other times. It's always an honor to have you, Brandon. Brandon is a team psychiatrist. He's a therapist, a trainer, and a teacher. He studied with David Burns for many years. Brandon has a private practice where he sees older teens, adults, and couples. He also runs a number of...
Where is the private practice located?
That's in Oakland, California.
California, yeah.
Mm-hmm.
Okay. Sorry to interrupt.
That's okay. It's really important information. Brandon also runs a number of online self-help groups, including the Feeling Great Book Club, the 5 Secrets Deep Practice groups, and groups for freeing yourself from addiction to screens. Brandon's next 5 Secrets Deep Practice group will begin on October 5th. It'll run for 6 weeks through December 10th. The time is noon or 12 to 1:30 Pacific Standard Time. His next 5 Secrets practice group, it'll last for 6 weeks, will begin November 5th, ending on December 10th. It's from noon to 1:30 Pacific Standard Time. If you're interested in joining any of Brandon's groups, please go to Feeling Great Therapy Center, that's all one word, feelinggreattherapycenter.com/educational-groups.
And if someone wants to contact, and we'll hopefully get you folks all jazzed up for this 5 Secrets Deep Dive group, because that's what it's going to take if you really want to master the 5 secrets in your life. And what else was I going to say?
If you want to contact me, you can write.
Oh, yeah, like for therapy or something like that. Or to get more information, how do we contact you, Brandon?
Probably the best way is to email me, and my email address is Brandon Vance, BRANDON, V as in Victor, ANCE, @gmail.com.
And is Brandon Vance one word?
Yes, that's all one word.
And then at gmail.com.
Yes. Yep.
No MD in there.
No MD in there.
Oh, okay.
Yep.
At gmail.com.
Hi, Brandon.
Thank you. Hi, it's great to be on today. And my wife, when I told him what we were doing, she said, it sounds like Harry Potter, that we're doing disarm practice.
Yes, that is our topic for today. Disarming extremely challenging statements that people have made to us, either personally or professionally.
Well, today we're going to be focusing on the disarming technique, which is perhaps the most important of the 5 secrets of effective communication. And for me, it's really been a life-changing experience to learn how to use the disarming technique. It's what the world needs more of. Sadly, I don't think it's going to be getting a whole lot more of it. But it's a very powerful interpersonal tool for personal relationships. If you're a therapist, for relationships with patients, and it's not just a psychological technique, but I would say it's to some extent a spiritual technique as well. And the idea of it, we all get criticisms from time to time, and if you're a team therapist and you use the evaluation of therapy session and you have your patients rate you on helpfulness and empathy at every session with very sensitive tests, and they write down what did you like the least, what did you like the best, and so we kind of open ourselves up to criticism. And the idea is when the patient is critical of the therapist to turn that into a positive experience with the 5 secrets, especially the disarming technique. And the same is true if you're used to getting into arguments with your intimate partner, or a family member, or a colleague at work, or whatever. And the idea behind the disarming technique is what I call the paradoxical law of opposites, and it goes like this: if someone gives you a criticism which seems unfair or illogical or exaggerated or just plain untrue, you'll have the irresistible urge to defend yourself. That's like a knee-jerk reaction. All of us human beings do that, and very few learn how not to get defensive.
Yeah.
And I think you all know very well that when you get defensive, the situation 100% of the time will escalate. And the law of opposites states that if you defend yourself from a false criticism, and this is the weird part, you'll instantly prove that the criticism was correct all along. And you'll see many examples of that. But when you defend yourself, which you will foolishly do, like the rest of us, from a false, unfair criticism, the fact that you're defending yourself will prove that criticism was absolutely true all along. So that's paradox number 1. And paradox number 2 is just the opposite. If, and what we're going to try to teach you today, if in contrast you genuinely and humbly acknowledge the truth in the criticism that doesn't seem to have any truth in it, it always does have truth in it, and if you acknowledge that truth, the very moment you do, it won't be true anymore, and the person who's criticizing you won't believe it anymore, and that's also a paradox. Now, so far, this just sounds like philosophical bullshit, and it is, but very high-level bullshit, I might say. And we're going to turn this into an emotional reality, and we've made a list of impossibly difficult criticisms, and then we're going to attack each other with them, modeling family interactions or loved one interactions or therapist-patient interactions, and see if we can disarm these criticisms. We can use any of the other 5 secrets: I feel statements, thought empathy, feeling empathy, inquiry, stroking, whatever as needed, but the emphasis is on the disarming technique.
And just to jump in to illustrate what you're saying about the law of opposites, David, I think just a very brief, simple example is like, David, you never listen to me.
Yeah. Well, I'm listening to you right now, Brandon, because you just said, David, you never listen to me, so you're wrong.
Yeah. So what does that show? So David's being defensive. He's proving that he's not really listening to me. He's saying I'm wrong. He's saying I'm listening to him now. He's not really listening to the hurt that's coming from me, maybe the anger that he hasn't been listening to me. So yeah. what would be a different? So let me say that again to you, David.
Let's just stick with this example. Why did my comment prove that you were right?
Yeah, you're telling me I'm wrong, which isn't really listening to me.
Yeah.
Right.
Yeah. I'm putting you down, which is kind of what you've been complaining about. And I proved that I'm not a good listener.
Yeah.
And let's try. Want to do a role reversal, and you can illustrate disarming?
Sure. Yeah, sure.
Brandon, I've been trying to tell you this. I've been trying to tell you this for years, and you never listened to me. Damn it.
Oh, gosh, David, I feel really sad as you're saying that. And I notice your anger, and you've been trying to tell me things this for years, as you're saying, and I haven't been listening to you. And I feel crushed. I like you. And as I'm reflecting, I notice that you have been trying to get my attention, and I haven't been truly sinking in, listening to you, giving you space to talk about what's bothering you. And I really am wondering how I'm doing right now, if I'm at least hearing you right now. And I'd love to hear more about what's been happening for you, how I'm not listening to you.
Okay, how did that work? How did you grade yourself on that? And we'll hear Rhonda's feedback as well.
I'm feeling nervous. I think I was a little wordy, which happens when I'm nervous. I'd say, let's see. I forget if I acknowledged your anger, which is, I think, a real big pitfall. I might have acknowledged hurt. So I'd say probably a B.
Yeah. Okay. Yeah. It was a strong B. What was your assessment, Rhonda?
I would have graded you higher than that, Brandon. I thought you did acknowledge his anger.
Mm-hmm.
And I didn't, but I didn't hear you stroking. Is it or do you think that when you say I really like you, is that stroking?
That would be stroking.
I think of it that way.
You think of that as stroking? Okay.
Was it genuine?
Mm-hmm.
Yeah, it is genuine.
Yeah.
I'm looking at you and I'm feeling that.
Okay.
But the gold standard is, David, what was your experience of it? So, yeah, what would you grade it, and how did that feel to you, as I was saying?
Well, I would have given it like an A- or something like that. I thought it was really good. I thought there was a little room for improvement. I didn't write down exactly what you said. I'll start doing that. And by that's one of the tips, if you're listening, write down what we're saying, and then you're in a position to critique it. Let's do a role reversal. Let me model it. And you can say you never listen.
David, I've been trying to tell you this for years, and you just never listen to me.
You know, it's so painful for me to hear that. I feel a lot of shame and sadness because I have to agree with you completely. For years, I've been a poor listener, and when you've tried to tell me that, I get all defensive and kind of put you down, and I've only recently realized that I've been doing this, and I can only imagine what it's been like for you to feel, alone and hurt and ignored, and maybe kind of pretty pissed off at me for good reason. And although it hurts a lot to hear that, and I'm feeling sad and ashamed. I'm very excited too, because this is the conversation maybe we need to have to get on the same page and develop the kind of close relationship that you want and that I want too. And with that in mind, tell me more about, what's been like when I haven't listened to you, and how frustrating that's been, and how alone that you've been. And that this is incredibly important.
Yeah, how would you grade yourself, David?
Well, I thought it was good.
Nice. I also felt it. I felt it was really strong. You just seemed very, very genuine, seemed right there with me. And I think that's what is the most important at the basic level of it. And then you acknowledged my anger. You said your own feelings, and you really gave all of the 5 secrets.
Yeah.
There was one part where I felt like could have been a pitfall, but I don't think it was here. But there can be a tendency to want to problem solve and say, like, this is when you said, like, this is where we need to be, and let's see, you said excited because this is kind of the conversation we need to have to develop a close relationship. And so I thought that worked very well because it was positive about our connection. But I think there could be a pitfall if it became about, okay, let's now jump into working on our relationship.
Yeah, right.
But you circled back to the inquiry, which then was really powerful, and said, I really want to
tell
hear
me about your negative feelings with that in mind and what it's been like for you. Yes, that problem solving is a real killer when it sneaks in there, and try to avoid problem solving. Great feedback. Any comments you have, Rhonda?
It's just a joy to listen to you, David. And not only is it the words that you're saying, but the emotions come forward. When you said you feel shame and sadness, I can really feel from you the connection between you and Brandon, even online. Yes.
Yeah. And is there any principle that we used here? And when someone is saying you never listen, they're making a kind of an exaggerated statement.
Mm-hmm.
But it contains a lot of truth. I can't think of what the principle is other than listening to the music, hearing what the person's really saying, and understanding what their experience has been like, and acknowledging that.
Yeah, I think of it as, I think of thought empathy as reflecting what they're saying, and I think of the disarm as finding the heart of the criticism. So it might be something beneath that. Here, it's the same thing. You never listen to me, but part of the heart of that might be you don't take me seriously, or there might be something else there that's the heart of it. But if we can tune into the heart of the criticism and then validate that, I think of that. I also think of you were mentioning the spiritual nature of disarm, which I think is brilliant, and it requires, or it asks of us, for the death of the ego that you talk about in your books.
Yeah, that's why it's hard.
Yeah,
this is one of the great deaths of the self.
Yeah,
and this is the interpersonal great death. Of the angry, blaming self, and to me, it's often the most painful of the four deaths of the self.
Yeah. And here, I think, in order to not be defensive, and with any kind of interaction with a disarm, in order not to be defensive, you have to drop your ego, and you're standing beside the person looking at how painful this is and how angry you might be if somebody acted the way, like if somebody didn't listen to you for 3 years.
Well, I've got a list of some impossibly difficult criticisms, and I sent to both of you, and I'd be willing to be attacked by one of them, or to attack either of you with one of these super difficult ones. Does anyone want to volunteer to be on the receiving or giving end of some really serious? The idea is, can we come up with a criticism that's so bizarre that it'd be impossible to agree with it, and then agree with it?
Yeah, go ahead, Rhonda. Are you going to say something?
Well, one of the principles that you said is that sometimes we don't agree to exactly what the person has said to us. Like with you, I'm not listening. You did a beautiful job and you used exactly what Brandon said. You're right, I haven't been listening. But what about something like, I wish you had died instead of Mom?
Yeah. So do you want to answer that one, or do you want to attack with that one?
Well, I've been thinking a lot about that, so I can answer it. Okay,
you want to attack Rhonda, Brandon, and
sure.
Rhonda, you can respond with your disarm. And if you're listening, again, write down what Brandon says and how Rhonda responds, and that way you can critique it really beautifully and see, does Rhonda really find the truth in what Brandon is saying?
Mm-hmm. Rhonda, I wish you had died instead of Mom.
Wow, Brandon, I have clearly hurt you, and You just told me that you wish I had died instead of Mom. I can feel my heartbeat and tears welling up behind my eyes, and I can see in your eyes and hear in the tone of your voice how angry you are. And I'm so anxious and worried that I've hurt you, and so sad that I have hurt you. You're my son, and you're the most important person in the world to me. I love you so much. And I'd like to hear more about what you're thinking and your experience so far since your mom has died. My heart really was pounding, like, oh my God.
Yeah, I could tell. And that made it really powerful for me, Rhonda. Oh. I could tell you really cared and you were really there. You really were into this. You really were upset and loving and caring.
What grade did you give yourself, Rhonda?
Well, I'd give myself a B+ because I thought the disarm was pretty good, but I think it could have been stronger.
Mm-hmm.
Yeah. What grade did you give it, Brandon?
I gave it an A. I felt like it really connected with me. When you say that disarm could have been stronger, though, thinking about it, I think maybe it could have. Mm-hmm. I wonder what you would come up with if we were to do it again. I think sometimes it's helpful to give feedback and then to run it again. Mm-hmm. Would you like to take another swing at it?
Okay, so I'm not going to say, oh, you're right, I wish I had died instead of Mom too, because that would be against the principle of saying something, using exactly the words. I'm thinking maybe about being more specific.
I can give you a couple tips if you want, Rhonda, if you want to try it again.
Okay.
I'm not sure I heard you acknowledging the anger.
I thought I did.
You said,
but maybe I didn't.
Really hurt you, and I can feel tears and a heartbeat, and I'm anxious and worried I've hurt you. You're my son. I'd like to hear more about your thinking and experience. That's what I wrote down.
Okay. I thought I said I see the anger in your face, even when you're saying that to me. But I'll be more clear this time.
What were you saying about the anger in the face, or?
I thought I said I see the anger in your face as you're telling me that. But if you didn't hear it, I didn't do a good enough job of stating it.
Yeah. But when you said, I'd like to hear more about your thinking and experience, that's pretty vague. Mm-hmm. And I like to direct people to what I want them to talk about. Otherwise, they won't talk about it. Because they can't read my mind, really. And so can you tell me about the things that I've done that have hurt you the most, and the times that you really wish I was dead? It's super painful for me to hear that I've missed the boat that much with you, because I love you a lot, and I've clearly not conveyed that to you. And I wouldn't be surprised if you're so hurt and angry and really sad and frustrated. And tell me all about that. I want to hear about all that negative stuff, your anger, and where I've screwed up.
I also wonder, Rhonda, if you were to say if we're just, as we're thinking about it and brainstorming, if you were to say, what is the heart of that criticism? I wish you had died instead of Mom. What's the heart of the complaint?
Well, I could go in a different direction. The person, they're missing their mother. It's a sadness and a grief over their mom. And I've clearly let them down and hurt them.
Yeah.
And so that's brilliant, Brandon. You're saying that the grief over the loss of the mom maybe could be shared here also. Asked about.
Yeah. And the other thing I think about is, in terms of them saying it, it might be like something around like, I'm not who you want right now, or I haven't been meeting your needs, and you're wanting your mom.
Yeah.
Something around that.
Yeah.
So do you want to, Rhonda, take another swing and incorporate that feedback?
Sure.
Or Or do you want to do a role reversal and let Brandon model it? What do you want to do, Rhonda?
I'd like to do both. I'd like to try one more time and then hear your version, Brandon.
Cool. Sure.
Okay.
Sounds good. And sometimes I like to give, okay, there's a scenario. And just define, I'm your son, and you're maybe mama, and we have mom. Maybe I have two moms and your mom, and I'm talking about mom. Mom passed away. Here I am saying what I'm saying. And then, okay, so mama, I wish you had died instead of mom.
Brandon, it's so painful to hear you say that, and I clearly have not been meeting your needs. I've let you down. I've hurt you. I've done things that have hurt you, and I haven't conveyed to you the amount of love that I have for you. You're the most important person in my life, and I imagine you're feeling a lot of sadness and grief over the loss of your mom, but also anger and frustration and maybe a sense of being alone toward me, but anger and sadness with me. And what I'd really like to know and hear from you, Brandon, is all of the times I've let you down, all of the most painful times, all of the times when I've made you feel the most angry, where I've done something that have led you to have that thought that you wish I was dead instead of mom. It's going to be a painful conversation with me, but I want to hear those things from you. Okay, I didn't know how to end it.
Right. How did that feel?
It feels awkward. It felt better, but it also feels awkward.
Yeah, what felt awkward?
Not really knowing how to end it. Like, I want to hear all these things from you. Tell me when I've let you down. Tell me when I've made you angry. Tell me when I've hurt you.
And that you don't feel comfortable ending on that, Rhonda, that inquiry?
Well, I think that inquiry was better than what I said in the role.
I really like the way you just put it. First.
Yeah. The first time I felt like I was babbling, and this time it felt more strong.
Yeah. Also, the first time you asked about what happened, but you didn't ask to share my feelings. And this time, as you phrased it, the inquiry was about my feelings as well.
Yeah.
And including anger. I think that was really nice. The way David said it, and you said it here, is that you're really open to hearing all of my feelings, my anger included, like everything. I think the way you first said it, it also felt maybe a little too directive. Like, here, we're going to have this conversation. It's going to be painful, and here's what I want you to tell me. And I want it to be very permissive as I'm doing an inquiry.
I love that. Okay, Brandon, are you ready?
Another piece that one could throw in there would be it's really a harsh statement and devastating to me. But to tell you the truth, I'm kind of proud of you for coming up with it and being so open with me with how you're feeling. That could be something of value too.
Yeah.
And as long as we just keep talking about your desire for me to be dead rather than acting out on it, it's cool.
Yeah, right.
You want to try a role reversal and see how Brandon's going to model it?
I'd love that. Are you ready, Brandon?
I'll try, yeah.
Okay. And so now the context is you in relationship with a mother who had died, and it's your child saying this to you.
Yeah, so I'm the right. Got it.
Okay. Dad, I wish you had died instead of mom.
Oh, my love, Rhonda. I just feel I feel crushed to hear that you wish I had died instead of her. And I imagine you're really disappointed in me and really angry, probably furious with me, and maybe lonely and sad about mom, as am I. And I'm not who you want right now. I think you want your mom, and yet I love you, and I'm here to hear all of your feelings, anger included, when you want. I really want to hear about what you feel about mom not being here, and about me, and maybe how I've failed you over these times since she's passed away. Would you like to talk some more?
Okay, what grade do you give yourself there?
Probably an A minus.
And where is the minus part?
Yeah, my mind always goes a little blank as I'm doing this on a podcast, and so I'm not quite sure what I said. But I feel like, let's see. I think there could have been some more stroking there. I said my love in the beginning, but I didn't. I did say I love you and I'm here. I think so. Yeah, I'm not sure, but it felt like maybe there could have been a little bit more of that. And like you said, David, I like the idea of appreciating that they're bringing that up, but saying that in a very genuine way, like the courage to speak up to me and tell me I've failed them. Wishing I had died instead of mom. Something around that could have been helpful.
By the way, the theme here is that we all hear these devastating things every now and then, and depends on how open your relationship with other people is and how inhibited that they're feeling and how good you are at receiving criticism. But the idea is that although a great failure and great anger is being expressed, this is an opportunity to deepen the relationship and create a truly loving relationship if you do not respond defensively.
Yeah.
Do you have any feedback, Rhonda, for Brandon?
I loved the beginning when you said, "My love, Rhonda." I felt, that was just so sweet. And you started with the "I feel" statement. You feel crushed to hear that. I felt kind of argumentative when you said that. I don't care how you're feeling. I just told you how I was feeling. And in the end, when you said, "I want to hear how you're feeling," I also felt kind of argumentative, like, well, I don't want to tell you how I'm feeling. But then you followed that up with how you're feeling, because I'm imagining I'm an angry teenager or I'm an angry adult, and so I'm still in this place of attacking.
Yeah.
I loved when you said, "I'm not who you want. You want your mom," and that's the disarm, right? Yeah, I thought that was very powerful.
Yeah.
Mm-hmm.
Yeah.
One mild little thing that I want to throw in there, in addition to all the good things that you mentioned, Rhonda, and when you're sensing that ongoing anger from the other person, you want to take a look at what you might have said that fed into that. Probably the disarming technique was missing. I feel crushed to hear that you're saying that, and you I'm sure you feel especially angry and lonely and sad regarding mom. I love you, and I'm here to hear how I've failed you. And then you ended, would you like to talk some more? And then the angry teenager will say, not really.
Right.
So since you're already talking some more, it's kind of a pointless question that might go in the wrong direction. Just say, as painful as it is to hear what you're saying, I have so much respect for you to tell me these things, and I'd love to hear more about ways I've failed you and ways you're really hurting and missing mom. I know the two of you always had such a beautiful relationship, and you loved her as I did, and when you say that you wish I had died, it sounds pretty angry, and I'd like to hear more about the anger. I think I haven't been really open to hearing your feelings, but I'm ready to listen now.
Something.
I
really like that inquiry, David. Yeah, that feels very powerful. And as I picture myself as a teenager, I feel engaged with that.
Yeah. Why?
Yeah, I think I think my disarm was like, I'm not who you want right now. And I think I could have led with that instead of having that in the middle. And I think if I'm leading with how I'm feeling, then Rhonda, you're saying, like, it's kind of like, well, I don't care about how you're feeling, Dad. Like, what the hell? I'm telling you, I wish you had died instead of Mom. Like, it isn't about you, like, right. So,
Yeah.
so leading, and that's one of the principles that I think can be helpful, is generally leading with a disarm can be quite helpful off the bat, and not always, but I think that can be a principle to consider.
What would be a big fat disarm? I wish you had died instead of Mom.
I mean, I guess what occurs to me is I haven't been here in the ways that you've wanted me to be. I haven't been like Mom, and you really miss her, and I'm not Mom. Something like that.
Yeah. What you're really saying is, I haven't been here for you.
Yeah.
As a loving parent.
Right.
Especially not in the way that she was. And you're saying that I've failed you big time. And it's devastating for me to hear that, because I agree with you. And I'm really feeling incredibly ashamed, especially, and I wouldn't feel so bad if I didn't love you so much. Yeah. And I can imagine how alone and lonely and angry you're feeling, as well as missing your mom, who was such a beautiful person, blah, blah, blah,
Mm-hmm. Yeah.
But the stronger that I have failed you, the more that I'm not failing you.
Mm-hmm.
Something like that.
So kind of
I want to jump on to a little different one here.
Yeah.
Yes.
We're doing easy here. But I want to give somebody, see if someone wants to try a really hard one. If someone's feeling really, really brave. And
Brandon, do you want to try a really hard one?
Sure.
Not that was such an easy one.
Go ahead, David.
Okay, you want me to be the attacker?
Yeah, sure. I mean, do I want it? No, not really, but yes.
Yeah. Let's see. Dr. Brandon, you're the worst shrink I've ever gone to. Did you do your psychiatric training at a veterinary school?
Wow, yeah. When you say that I'm the worst shrink you've ever gone to, I have to agree. I haven't been doing a good job by you. And I feel really sad. And I can imagine you're probably feeling pretty furious, maybe betrayed, maybe kind of lonely as we've been meeting, and you haven't been making the progress you've been wanting to make. In fact, it sounds like you haven't been making progress, and you feel like I have not been helpful. I've been worse than anybody you've seen. And even if I'd gone to vet school, I might not be as good as this. And I might not be better, or maybe I had gone to vet school. And so I'm really appreciating you bringing this up right now. I think this is super important, and you're important to me, and this is an important conversation. I think I haven't been doing my best with you, and I've also, and I need that kind of feedback. And I want to hear how I failed you, and I want to hear more about your feelings, more about your anger and any other feelings of hurt, maybe betrayal. Can you tell me some more?
Okay, what grade did you give you that?
I'd say kind of.
Do you give yourself on that?
Yeah, I'd say B plus, A minus, somewhere in that range.
Okay, and then how did you critique it?
Yeah, I feel like I think there's going back to something you said earlier. I think that highlighting that there is an important moment here. It took me a while to get there, but I think that was important, and I think it was validating of what they were saying. I maybe could have kept it shorter and gotten to the inquiry. I said, "You're important to me." I don't know that was a very powerful stroke in terms of stroking. I think saying something specific of stroking, I think it's really important to say something specific about the person. The more specific, the better. And I did acknowledge their anger, my own feelings. I'm forgetting what I said in terms of that.
You said I'm sad.
Mm-hmm. Sad? Yeah. Yeah, I could have said maybe a little bit more powerful feelings there.
Yeah. What was your grade, Rhonda, your feedback?
Well, honestly, Brandon, I gave it an A. Your disarm was strong. I have to agree. I haven't been doing a good job. I mean, there you go. I'm sad. Your I feel statement. You're feeling furious, betrayed, lonely, feeling empathy. And then you went into thought empathy. To me, that was a stroking when you said you really appreciate how bringing this up. It's super important. And then your inquiry, I want to hear how I failed you, your feelings of hurt and betrayal. You said furious. And once you acknowledged the anger at that level, I felt just so calm and ready to talk to you.
When this fellow says you're the worst shrink I've ever gone to, did you do your training at a veterinary school? What is the person saying? You took it as a lack of competence and skill. I haven't been doing the best job. But what's the person really saying?
Well, they're saying you failed me. I mean, you've right.
There's something more than that. Or failed me in what way? Because your therapy techniques haven't cured my depression. Is that what they're saying?
Well, there's probably something I did that really hurt them or angered them. Maybe hurt beneath the anger, but there's something there that was a real. I guess I think of a failure in that way, something that felt destructive to them. I would imagine.
Yeah. Right.
Yeah.
Are they saying you've done a great job at creating a warm, close, trusting relationship with me?
Probably not at all. Yeah.
Yeah. And is that the thing that's got them the angriest?
It's hard to know. I mean, I guess I would want to ask them a lot more.
Well, how would a veterinarian and
right.
The patient who has the upper hand?
The veterinarian.
Yeah, and does that warmth and love develop between the veterinarian and the patient they're examining?
Well, if it's a nice, cute puppy, maybe there is.
Yeah, a good vet will convey that. Right. What's this fellow saying? You're such a wonderful veterinarian.
Yeah. So it could be really about the relationship, and I'm not approachable. I'm not connecting. Not connecting with them.
Yeah, and is that true that you're not connecting with them?
Yeah, absolutely.
So how would you agree with that?
I haven't been creating a warm and close and comfortable and safe relationship with you here.
And I've realized that too, I would say. Especially the last couple of sessions, you gave me a real low grade on the empathy scale, and I felt that too. Yeah. And felt like I wasn't understanding you. I wasn't being close to you. I wasn't being, trustworthy and getting where you're coming from.
Yeah.
And clearly I've missed the boat. To say nothing about your symptoms, you're as depressed today as the first day you came. and it wouldn't be so painful for me if I didn't actually like you so much. And yet I've been totally screwing up, blah blah blah, and but I think that's the thing they want you to disarm, to hear what they're saying. That now I might be tone deaf myself and often am, but I think that's what this patient would be saying.
Yeah. The relationship. Yeah. I think also that something that you've brought up a couple of times is in these interactions is changing the focus a bit. So it's sort of acknowledge. Like I wonder, like I've noticed that too. Yeah. And then that especially with patients, but also with other people, right? It provides an opportunity to then acknowledge something that's been difficult. And go deeper, go further.
Yeah. You want to try it again, or you want to try it, Rhonda?
What do you want, Brendan?
Do a role reversal, or what would you guys like to do now?
I could try it again. Sure. I'd love to take another.
You want to sock it to him, Rhonda?
Sure. Dr. Vance, you're the worst shrink I've ever gone to. Did you do your residency training in a vet school?
Wow, Rhonda, I think you're right. I think I haven't been creating a really warm and comfortable and safe atmosphere here. I obviously haven't been connecting with you. And I think this is super important you're bringing this up. I feel, I can only imagine feeling angry and for you feeling angry and sad and not connected. And for me, I feel kind of crushed as I really care about you. And I enjoy working with you, and yet I've not been doing justice to this relationship and to you getting what you need here, both in terms of your depression, but also just in terms of our connection. And that really makes me sad because I care about you. I wonder if I could hear some more about what's been going on. I've noticed that disconnection as well, and I felt a little awkward about it and really admire you for bringing it up. And could you tell me some more about how what I've done in terms of not fostering a better relationship, and also how you've been feeling?
So what grade would you give yourself for that one, Brendan?
Certainly better. Maybe an A-. I think I've floundered around at some times. And I think I found my genuineness, found my center. And I think that sometimes happens with these practices. But this is like what feels really genuine and true. And I think something to remember, and then we can come back to how I grade myself. But I think something to remember also is that it's dynamic. Usually, if we can disarm right up front, then that purpose of that is partly connection, partly them being heard, and actually disarming, right? Dropping me dropping my defensiveness, them dropping their anger some, or feeling heard with it, so it's not aggressive and it's not this barrier in between us. And then there can be more connection. If I don't do it adequately the first time, usually it's a conversation. So it's not just one statement and then it's done, but I can come back and disarm again. I can say, oh, I'm still missing you. Mm-hmm. Can you tell me some more? Let me try to listen here. So I think that's one principle. To circle back, I feel like I got wordy. I don't feel like the inquiry was that strong, but I feel like something in there felt like it was effective. Felt like the disarm was more effective this time. What did you feel?
Who were you asking?
I was asking. Well, David, go ahead. Yeah.
Okay. I'll give mine. I thought it was probably an A-. And by the way, I think that the things we're dealing with, a B would be way beyond what anyone's heard. That would be way sufficient. So we're looking at fine points, but I think the disarm still could have been stronger. To say something along the lines. You see, I haven't been creating a warm space. That still sounds very technical.
Yeah, yeah, yeah.
To
I
me,
get you,
it's technical about wormy spaces, but it's still
yeah.
a technical statement. And
It's also kind of, I haven't been doing something positive as opposed to like I've been doing something that might be negative. Sometimes that might be
and he's still the dog, and you're still the veterinarian. But I think I might say it's really painful to hear you say that, but we're on the same page because I've been experiencing exactly the same thing. I haven't been feeling close to you, and I certainly haven't done a good job of creating the warmth between the two of us. And it's kind of, I feel ashamed, and it's so painful to hear what you're saying. But at the same time, to be honest with you, I'm kind of proud of you for saying it, and I'm excited about it. And I'll tell you why. You told me at the initial evaluation that you have trouble getting close to people, and that people are always letting you down. Your father, you never felt close to your father, and your friends, there always seems to be a kind of a barrier. You can never really become vulnerable and open and close to them. And that's happening between the two of us right now. And so the elephant is in the room. The enemy is here in the room, and we can talk about it and kill that enemy. But the best way is just to tell me what that's been like for you. All your negative feelings. You must feel so pissed off at me and ripped off and disappointed and sad and hurt and alone. And I want to hear your words, hear what it's been like for you. All I can say, this is extremely important, what you just said. And I'm all ears. I want to hear everything you have to say, especially all the hard stuff, the negative stuff.
Yeah, so that sounds like an A+ to me.
Yeah, it does. Why? Thank you. You're generous.
I mean, it makes me also think of how we get practice with this with patients. If you use the evaluation of therapy form, then you get a lot of practice because you can disarm any negative criticism that's there. And so I think it's such an important part of team therapy. And that was just beautiful to create more connection and acknowledge what's going on, acknowledge the elephant in the room.
Yeah. One of the most important things, I think, is a lot of practice. And even in this situation today, there's been a little bit of practice, but it's really high quality practice with tremendous detailed feedback. But I wanted to mention that before he left the company, Jason Mino created, at my request, what I call a love bot, which is an AI that can role play all the 5 secrets with you, including the disarming technique, and it can go on unlimited. Like you can practice for 18 straight hours with it if you want, and it's absolutely free of charge. And so I'll try to put a link to it in the show notes. And I'll ask Sevda, our marketing person, how people hook right into that. And if you're a therapist or a general citizen, either way, we'd love to have you try it. I haven't tried it myself yet, so I don't know how good it is, but the people who've tried it are pretty excited about it. But it's it'll criticize you over and over again, and then when you try to disarm, it'll give you a sophisticated critique and grade.
Yeah, and it gives you some suggestions as well to consider. It's pretty cool, and it takes a little. There's a certain way to get there. You do a short session, and then you go to the end of the list of techniques.
Oh, you've tried it?
I did try it last night. Yeah.
Oh, is it any good?
It's pretty cool. Yeah, I just gave it a little whirl, but
wow,
it's a pretty cool way to practice.
Oh, how neat is that? Thank you.
And so initially, I thought my version didn't have it on it, but you just got to choose a short session, and then you go to the methods, and then you want to practice a certain method. Right. You go down there and you practice the 5 secrets. It's pretty cool.
And maybe we can even get a direct path to it or something like that.
That would be neat.
Yeah, that's exactly right. How are we doing on time, Rhonda?
Well, it's an hour, so I think we're going to have to close pretty soon. And Brandon, you're teaching this deep dive into the 5 secrets, and I think you've done a brilliant job today. And one of the things I loved what you said is that we don't have to be perfect in the moment. When someone's attacking us, this isn't exactly what you said, but what you said was we don't have to be perfect in the moment. You can do another disarm. Mm-hmm. Like if you falter now, you can keep going, keep doing it. And when somebody attacks me like this, I think I'm going into that fight or flight where I just shut down and I can't think straight. And for me, what helps me is if I stop and take a deep breath and before I dive in.
Mm-hmm. Mm-hmm. Yes, exactly. Yeah.
Do you ever do that?
Yeah, absolutely. I think that's a beautiful kind of pearl. Sometimes I buy time even. I say, wow, what you're saying is really important. Let me take a breath here. I really want to be here and engage with you on this. Or I really want to listen to you. And so then that gives me a little time to have my heart not start beating so quickly, mm-hmm. and then be there for them. Mm-hmm. I think part of one thing that's helpful about the practice sessions that I do is that we do some examples in front of the whole group. And sometimes that provides this kind of anxiety, which in a way is good because in the moment when somebody's accusing me of something and I really care about that relationship, my heart's going to be beating faster. Mm-hmm. And it's going to be hard to think on my toes. So I want to really get a lot of practice to get better and better and better at it. Part of what I think also a benefit of that is that when somebody who's not involved in that relationship can then give their feedback and also they can try it, their ego isn't in the way, whereas mine might be in the way. So we bring our own personal examples. We also talk about other examples in these deep practice groups. And then somebody who's not involved in this relationship can give their take, and they already have the kind of death of the ego with respect to that relationship. So what would somebody that's uninvolved say if they really want to empathize with this person? And so sometimes also, I think one thing that you brought up, David, there might be a way in the show notes to give some responses to some of the really challenging ones, maybe categories of ones we didn't do today. But sometimes we just want to be specific. We don't really know what the person is talking about. And we don't want to be defensive, but if we guess too much, we might be really wrong. And tell me if I'm wrong here, David, but I think we might want to, if we just totally don't know what they're talking about, we might want to really ask some good inquiry and say, I know this is really important.
I could say I've failed you doubly. Not only have I done whatever you say I'm doing,
right.
I'm not even aware of how I've been screwing up, and maybe you can tell me more, some things I've done or said that have really hurt your feelings or turned you off.
Yeah, yeah. That's a beautiful, beautiful way of doing that.
Yeah, that's what I was going to say to you, David. I love your inquiry. It's so inviting. Instead of feeling like competitive or argumentative, it's just really inviting more sharing, more dialogue, more participation.
Yeah. One last question. I don't know if you've done a group like this previously. I know you're a master of groups and have done all kinds of, book groups and app groups and things like that. But on something like this with the 5 secrets, do the people in the group draw support from each other, or do they come as couples and they start fighting in the group, or what do you imagine is going to happen there?
Right. Yeah. So I've done these a number of times before. This may be my 5th time, something like that.
Oh, awesome.
Heather Clegg also does them, the fantastic psychiatrist, therapist, teacher, Heather Clegg. She has one starting in January. So if you go to that same link we talked about, feelinggreattherapycenter.com/educational-groups, and then go to the 5 secrets deep practice groups, hers will be there too. And yes, people get a lot of support from other people, and sometimes they're going through similar things. We've had a number of folks in the group have had like teenage kids and then have had conflicts with them, so they can get both support and figure out some strategies. Sometimes couples take it together. And that can be really helpful. I did one just for couples. We haven't got enough couples to do that again, but I would be happy to do that also, because that can be very fulfilling to have not only working as couples, but have other couples in the mix too. And sometimes they'll get really triggered. So we have some ground rules, and we have some ways of helping each person to use some lighter topics first before getting into their own issues.
Yeah,
develop a skill set.
Important.
Yeah.
Learn the mechanics at least.
Exactly. Yeah.
And Brandon, one of the other podcasts you were on with Heather Clegg was episode 161, and that's where we laid out what's the music underneath the criticism. So I'd really like to invite everyone to listen both to this podcast. Actually, they've listened to it since we're at the end of it, and podcast 161, where Brandon, you and Heather both shone.
Now, I suggest a finale. That's great, whatever you're all saying. I suggest a finale for our podcast. We'll do Robin, go to the impossible criticisms, and like Rhonda can criticize me, and I'll try to disarm. And then I'll criticize Brandon, you try to disarm. And then Brandon will criticize Rhonda, and you try to disarm. And in each case, we'll just try to attack the person with the most impossibly difficult criticism. And you can hit me first. Do you have that list in front of you, Rhonda?
I do.
Okay, so find something there that David couldn't possibly agree with, and then I'll try to disarm you.
Dr. Burns, you're trying to kill me.
You know, I hate to admit this, but you're right. I've been I haven't created a warm connection at all, and I don't think I was real trustworthy in our last session, and I want to hear more about that. You know, it breaks my heart. And I feel ashamed to see that I have failed you like that, but I can't. I have to agree. Our last session was rough, and I screwed up big time. So I'm your great advocate right now, and we're on the same page. And I want you to tell me all about that. And I can imagine how scared you feel, how angry you feel, and how mistrustful you feel. And I can imagine you're in a lot of pain. And you know, tell me about it.
Okay.
So how was that?
That was pretty amazing.
Yeah. Okay.
That was fantastic.
Yeah, and this would probably be from a psychotic patient, maybe on an involuntary inpatient unit, and we're just agreeing with the essence of what the patient is feeling, not necessarily the literal words. And in my experience, it works very nicely with individuals with psychoses. So now it's David's turn to criticize Brandon. Let's see. Dr. Brandon, I followed your suggestion on what to say to my relatives, and I even used the 5 secrets, and now they won't even speak to me.
And do you want them to speak to you?
Not really. They're assholes. That's what I told them using the 5 secrets. I said, I feel like you're assholes. And that's how I feel.
You did it. You did it. I'm proud of you. Fantastic.
Somehow it wasn't effective. Or it was effective.
I'm sorry. So if you want to give me that again, I was going to.
Okay. Well, I followed your advice and used the 5 secrets and talked to my relatives using those damn 5 secrets, and now they won't even talk to me, and it's all your fault, doctor, or mister, or whatever you think you are.
Yeah, I have to agree with you. I was playing up these 5 secrets, and I think it is my fault. And it sounds really rough. I'm guessing you're feeling really sad about this relationship and really furious with me that I gave you the suggestions. They didn't work to bring you closer and, in fact, push you apart. I really want to hear more about your anger, and I also want to hear more of what happened. It sounds like it was really rough and difficult for you. Can you tell me more?
Yeah, I'll give you an A on that one. That was A plus. I just thought it was lack nothing. It's great.
Great. Rhonda.
There are no easy ones. Okay, go for it.
Easy ones here. Rhonda, you've been having an affair, right? I'm your husband. It's super easy, right? No, but this is hard. I wonder how to do this. So
let's hear you disarm.
Yeah.
Well, I have been acting in ways that are not trustworthy, and I admit to that. I've let you down. I've hurt you. I'm imagining you're feeling really angry at me. I'm feeling super ashamed of myself and my actions. I love you, and I want to know more about what you're feeling and what led you to think that I'm having an affair. What's it been like for you to live with someone who perhaps is betraying you? And I'm feeling super ashamed, like I said, and actually I'm feeling also a little angry at you attacking me. But first of all, I want to hear what this relationship has been like for you.
Yeah. And I guess I have a question about this for you, David. I mean, before we do the feedback, even I guess one of the questions is how much information is there a role for giving some information? The pitfall there is to be defensive and say, no, I'm not having an affair. Yeah. But is there a role for saying, if there's a question, maybe it's like, you're having an affair, aren't you? And then it might be like, well,
no,
but
I think we need to have the context. And my assumption here is that you're not having an affair.
Right. So the scenario is that you're not actually having an affair.
And then when you keep saying, I have been untrustworthy and I'm super ashamed, and you say that 3 times, it sounds.
No, I said it 3 times. That's babbling.
To an affair that you're not having.
Right. It makes me kind of question and feel more anxious.
It means you get all the punishment and none of the fun.
Yeah, right. My thinking behind that is, when you're accusing me of having an affair, I have done something that has led you to feel that disbelief. So I do that lack of trust. So I'd like to know what that is.
It was the quickie you had with the barber.
Quickie with the barber. So the title of the next book here, The Quickie with the Barber.
The Quickie with the Barber. I feel a little proud that I acknowledged that I was feeling angry too. Like, I imagined you're feeling angry with me, and I'm feeling angry that you're attacking me.
Yeah, the you're attacking me is an especially good statement, right, Rhonda?
No, that's the opposite.
Why? Why is that?
Because now I'm attacking him for attacking me, and I'm being defensive and accusatory.
Yeah.
Well, one thing that people can do if they feel defensive, that we talk about in my group, is that if you're feeling defensive, then one thing you can do is acknowledge that. Like, gosh, I'm feeling really defensive right now.
Yeah, that's beautiful.
Let me take a moment and try to, because this is really important. Yeah. And I know you're right, but I'm feeling really defensive.
Yeah.
Oh, I love that.
Did you want to do a role reversal, Rhonda, and then we'll say goodbye?
Yes.
Well, I'm interested in you answering this, David.
Okay.
How would you do it? I want to sort of, like,
you want me to do it?
Yeah.
Yeah, sure.
So David, you're having an affair, aren't you?
Well, as a matter of fact, you're right. I think I'm having a kind of an affair with the world, but not with you. And I think there's been a lot of anger in our relationship, and I've actually pulled away from you. I would never have an affair with another person, but I've definitely kind of left you. And I can imagine how hurt and lonely you're feeling, and I've been feeling kind of, hurt and lonely too. That's why I've been pulling away, and maybe this is our chance to talk about it, and get back on the same page. But a good starting point, although it's hard to hear, is maybe you can tell me some of the things I've done or said that have been particularly cold and hurtful for you, and how you've been feeling. I can imagine unloved and jealous and angry and and put down. Tell me, I'm really ready to listen. So how was that?
I thought that was really, really effective. I think it was a little bit so I felt like what you said, I loved. Your kind of the body language, it seemed like you weren't as upset by it as I wanted you to be. Yeah. And so, but what helped with that was, I think at the end, when you were so specific about feeling unloved and jealous and angry, it felt like you really were tuned in. You said the things I've done that have been cold and hurtful. I was like, yeah, well, you're cold right now.
Oh, right.
But then it did feel really tuned in.
Oh, yeah. Yeah, great. So that needs that needs a little redo too. And so one of the ideas here is failing joyously, failing as fast as you can, and try to learn from those failures. So in that case, to bring more emotion into it right from the very beginning. So that you can be technically correct, but if you don't have the I feel statements, you're going to be missing the boat.
Yeah. This is Brandon. Beautiful. I think there's so much more we could do, so many more examples, but I feel like we covered some really big ones and some really important points.
Yeah.
And we hope you folks enjoyed because you've asked for more specific on how the details of how to use various techniques. And the disarming technique is one of the most powerful, one of the most important. And we hope we've given you some tips not only on how to use it, but what are the practice exercises you could do with a colleague, a friend, a partner, a family member, with anyone, if you really wanted to develop these 5 secret skills, so you could be more effective with your angry teenager, for example. I think we all have a lot of areas in our life where we need to be using the five secrets, especially the disarming technique.
Yeah.
Thank you, David.
And thank you, Brandon. We love you. You're one of our heroes and dearest friends, and you're always blazing trails with your creativity, not only in therapy, but in the groups you're creating. And I'm so grateful that you're alive and Heather's alive and doing these beautiful experiences for therapists and for the general public. And I hope a lot of people take advantage of your deep dive 5 secrets training coming up on, see if I can remember, November 5th for 6 weeks, ending December 10th. And it's noon to 1:30 each day. And you'll have plenty of chances to practice and learn. And at the end of those 5 weeks or 6 weeks, you'll be a different human being.
Well, thank you for your words, David. They bring tears to my eyes. I love you and love Rhonda as well. And it's you've really transformed my life with your teachings and also your warmth and friendship. It's beautiful. Yeah. Thank you so much.
You have a great afternoon, everyone.
Yeah, you too.
Bye.
Bye-bye.
This has been another episode of the Feeling Good podcast. For more information, visit Dr. Burns' website at feelinggood.com, where you will find the show notes under the podcast page. You will also find archives of previous episodes and many resources for therapists and non-therapists. We welcome your comments and questions. If you want to support the show, please share the podcast with people who might benefit from it. You could also go to iTunes and leave a 5-star rating. I am your host, Rhonda Borowski, the director of the Feeling Great Therapy Center. We hope you enjoyed this episode. I invite you to join us next time for another episode of the Feeling Good podcast.